related, but still positive news. Today, O'Neill Steel announced the opening of a new 64,000 square foot metal distribution center in St. Joseph, Missouri. The new facility will begin operations on June the 1st and support multiple industries statewide. The O'Neill Steel is part of the United States' largest family-owned network of metal service centers, and we are proud that it has chosen St. Joe as the location for its next distribution center. This announcement shows that even in the midst of COVID-19, there are still good things happening, and Missouri is still a top location for businesses. I might just want to say, back in January when things were going so well before the COVID-19, as you've seen in the year before that, we were having tremendous success recruiting companies to our state. New businesses were coming here. Jobs were expanding. There's no reason we can't pick up right where we left off once we get through this COVID-19, once we get the economy going. And I think the good news is about O'Neill Steel Company is when you look at Nucor Steel, who just started operations not too long ago, after they're completed. It's good that the steel manufacturers of this country are looking at Missouri and giving us opportunities. So that's great news for us to be able to share that with you today. And with that, let me move on to some COVID updates for today. Yesterday, I talked the importance of COVID-19 testing to Missourians' economic recovery and our goal of testing 7,500 people per day. I cannot stress enough how important this is for us to move forward. Testing and the economic recovery will go hand in hand. You cannot have one without the other, which is why we are working to rapidly increase our daily testing numbers. The more people we test, the quicker we can identify and isolate positive patients, and the more confidence we can give Missourians to re-engage in the economy. We have had several meetings this week to develop a strategy to reach 7,500 tests per day, and we will share more about that tomorrow. I think, as I mentioned yesterday, one of the areas we are going to target, an extreme amount of time is going to put it on the nursing homes across our state, because we know that is the place that we have concerns with that area, along other, quote, what we would call hot spots throughout the state of Missouri that we're going to start really isolating and doing more tests every day. But that will be one that we really want to get on to in a pretty quick fashion. I know Dr. Williams is here today. He's going to talk more about that when he comes up here shortly. Today we launched a new online dashboard with COVID-19 data from across the state. I know there have been some concerns over data reporting and delays, and I just want to point out how important it is for us to make sure this data is accurate. Throughout COVID-19, we have worked very hard to be transparent and provide you with the most accurate, up-to-date information as possible, and the same goes for this dashboard. We want Missourians to have access to the data and information we're using to make decisions as we work through the recovery process. On this dashboard, you can see interactive data on everything from COVID-19 cases to testing numbers, positivity rate, deaths, and hospitalizations. Much of the data is also broken down even further by county or demographics. The dashboard is a great representation of the trends we've been seeing across the state driving our decisions to reopen, and I encourage you to use this to stay informed and up to date on the situation in Missouri. One of the most frustrating things I went through at the beginning of COVID-19 was getting good information, good data, accurate data. There was so much information come from outside the state of Missouri that was totally inaccurate. A lot of think tanks were sending information and really turned out to be more guesstimates than it did anything on that. So one of the things that I realized early on, we had to be able to do our own data. The data you're going to see that we're going to make public has to do with only Missouri. And it's done by Missourians, and it's about who we are in this state and that data. It's not about projections. It's not about guesswork. It's about what's real and what's not in this state. And we were very fortunate to be able to put that together and to be able to utilize it as we move forward for other situations that we may encounter in the days to come. As we work through the recovery process, the Missouri National Guard will continue to play an important role, especially in regards to testing. Today, Adjutant General Compton is here to give an update, and I just want to say this. As a veteran, the one thing I do know as governor is to have the National Guard at your disposal to wherever you can send them, whatever you need to do. There's never no doubt in my mind about the Missouri National Guard, what it can do. And the one thing I do know, they are mission driven, and when you tell them to charge the hill, they're going to charge the hill. And right now, General Compton and his troops have been given the instructions, charge the hill. And at the top of the hill is testing. And we're going to make sure that we put all the resources we have in the state to do this testing. So General Compton's here today to give us a little update on what he'll be doing on the testing side. General?
Thank you, Governor. Hey, good afternoon. I am glad to provide an update on what the Missouri National Guard is doing to assist in our COVID-19 response efforts and reopening the state. We continue to support the Governor's Show Me Strong recovery plan and have almost 1,000 soldiers and airmen working alongside local and state partners. Guard men and women are conducting medical screenings at state buildings in Jefferson City, St. Louis, Kansas City, and Springfield as the state workforce returns. We continue supporting N95 mask decontamination at 13 collection and redistribution sites throughout the state, and there are many organizations signed up to use this program. Our Guard members continue to assist with meal distribution from multiple food banks and support the Department of Elementary and Secondary Education in the delivery of nutritious meals to our school-aged children. In conjunction with SEMA's Disaster Medical Assistance Team, we continue to support and operate the alternate care site in Florissant. Our civil support team is supporting state lab testing, and as the Governor just mentioned, we are working closely with DHSS, OA, and many other state agencies to expand testing across the state to support the health and well-being of Missouri citizens and help open up the Missouri economy. We look forward to the efforts that the Governor alluded to that will expand our testing in the very near future, and as he mentioned, that we'll roll out more details starting tomorrow. In addition, we continue to provide augmentation and logistic support to our interagency teammates to support a timely, coordinated response. I appreciate the partnerships and the incredible teamwork we've enjoyed with our state and local agencies. Much has been accomplished, working together and taking care of each other as one team. Governor Parson, thanks for your leadership, along with the support of our great partners and great communities across the state. Businesses are opening, and citizens are able to return to work. Missouri is recovering. Thank you for calling on the Missouri National Guard to help. We are proud to be part of this team of teams. We're always ready, always there. Show me strong. Thank you very much.
Thank you, General. I don't think you need to say any more closing on what he just said on that. I just appreciate General Compton and more important, just how blessed we are in this state to have the men and women that wear the uniform and what they represent, because nobody represents the values of the military more than the people that reside in this state. I also would like to say that COVID-19 has taken a toll on Missourians in many ways, not just physically, but also mentally for many people. As I've said many times, mental health is just as important as physical health, especially during difficult times like these. While we might not all be affected in the same way, this crisis has affected everyone, and we must remember to personally take care of ourselves physically and mentally. Today, Director Stringer's here with us to give an update on what his department's doing, but I want to say to the director and the employees at the mental health department for what they did during this time. You know, a lot of state employees, some state employees had the opportunity to stay home and be able to work from home, and we made that situation where they could do that. But there was hundreds upon hundreds of thousands of state employees in the mental health side of it that had to come to work every day and take care of people that couldn't take care of themselves, and had to put their fears aside during this whole time and still maintain to go to work and take care of people that need to be taken care of. And a lot of times it seems like those kind of people that I'm talking about is a little bit out of sight, out of mind for a lot of people. But it wasn't for those employees, because they stayed with it every day, day in, and they never missed a shift, they never missed a time, and they provided those service. So, Dr. Stringer, I want to thank you. I want to thank your department for what actions you took during this time. Dr. Stringer?
Thank you, Governor, and thank you for those kind words. I'd like to start by expressing my sincere condolences to the families and friends that have lost loved ones to this virus. I also want to again thank the many Department of Mental Health staff that, as the Governor says, continues to perform spectacularly during this crisis. This includes dedicated men and women who work on our state psychiatric hospitals, in our rehabilitation centers, in our state-operated community programs. I also need to acknowledge my department's contracted community providers of treatment, prevention, recovery, and rehabilitation services. I cannot tell you how much we appreciate your ongoing commitment to serving some of the state's most vulnerable citizens, especially during this most difficult time. So just a few updates this afternoon. First, I wanted to let you know that my department's Office of Disaster Services has developed what is called a behavioral health strike team that can quickly deploy specially trained individuals from our community mental health centers and the department's disaster team to work with an impacted region after a local emergency. This concept was piloted during the Branson duck boat tragedy. However, the outbreak of COVID-19 prompted us to fully activate and deploy this team for the first time. Strike team members worked in conjunction with the Air and Army Guard to assist families, individuals, and deployed service members in the St. Louis area. They assisted through crisis counseling, which involves teaching coping skills, managing stress, recognizing common reactions that people have after a disaster, and often just providing a listening ear. The deployment has been a success, and the team is standing by to provide further assistance. The second thing I wanted you to know is that my department has applied for a crisis counseling program grant. The Federal Emergency Management Agency, or FEMA, funds and oversees the crisis counseling program to provide mental health support and training in presidentially declared major disaster areas. And this is the first time, by the way, that all 50 states have requested disaster declarations. The third and last thing I want you to be sure that you know is that the month of May is our nation's Mental Health Awareness Month. While the pandemic continues, its effects on mental and emotional health can be as serious as the effects on physical health. This is a stressful time, certainly due to fear of the virus, but also because of restricted activity, reduced contact with friends, family, and coworkers, loss of employment, which in itself can be devastating. And our nation's farmers are facing incredible challenges. It's understandable then to feel overwhelmed, stressed, and anxious. If you're feeling that way, of course, you're not alone. The good news is that help is available, and in new ways that you should know about. I mentioned before the Federal Disaster Distress Helpline, which is staffed 24/7 with specially trained mental health professionals who can listen and hopefully talk you through whatever you may be struggling with. They can also connect you with services here in Missouri if you need help beyond what they can provide. That helpline number is 800-985-5990. And of course, you can also search Google the Disaster Distress Helpline, and it'll tell you other ways to contact them if you'd like to. I'm also glad to tell you that thanks to the leadership of Governor Parson, Mo Health Director Todd Richardson, and leaders in my department, the strict rules about face-to-face counseling and other mental health services have been relaxed so that now people can get services in their own homes through platforms like FaceTime, Zoom, and even just phone calls. Our community mental health centers, substance use treatment providers, and providers of developmental disability services have found that this not only helps to prevent the spread of the virus, but also encourages engagement, protects privacy, eliminates transportation barriers, and gets and keeps people connected with potentially life-saving services. In conclusion, I'll just say this. We're in this together, and although we may never be the same, we will be forever stronger. Missouri strong. Thank you.
Thank you, Mark, and thanks for all the people that work over there at the department. One of the things Mark said when he was up here that I think is something that every day I get more proud of my directors and my commissioners that work under the administration of how much they work across their own lines to help one another out. He just mentioned in there when he was talking about how he had worked with the Guard, how he had worked with other agencies across state. That's one thing that I can tell you. All my directors are all willing to help each other when they need help, and I'm not sure a lot of states can say that, but I can tell you it's one thing I'm really proud of for what they do. So to wrap things up today, I'd like to share a few words of encouragement to Missouri's 2020 graduating seniors. Tomorrow, I have the very special opportunity to speak at my granddaughter's high school graduation, and I'm looking forward to that. It will be the first time that I've spoken at a high school graduation, and I guess it'll be the first time my granddaughter graduates also, so it'll be a good day for both of us on that. And as grandparents of a senior, Teresa and I understand the challenges that many seniors are going through right now. And I know this isn't what they thought their senior year would look like, but there is still a lot to celebrate. The year 2020 will not be remembered because of COVID-19 virus. The year 2020 will be remembered as a launching pad for the next generation of successful men and women like yourselves that will make this state and nation better off than ever before. Tonight, in honor of Missouri's 2020 Senate seniors, Teresa and I are lighting up the governor's mansion for the first time in Missouri's history. And I will give credit to the First Lady. I think I get to just accompany her tonight, but this is really what she's put together, her and her team has, for the mansion tonight. So starting at 8:20 tonight, for you that understand military time, 2020 is what that military will. On the 20th day, the mansion will be lit up for 20 minutes and 20 seconds. So on the 20th day of 2020, the mansion will be lit up 20 minutes and 20 seconds tonight. So we're looking forward to celebrate that. Again, we know this wasn't how you expected your senior year to end, but don't let this define your entire high school career. There will always be challenges in your life, but it's how we overcome these challenges that matters. We're cheering for all of you. Congrats to the class of 2020, and God bless, and thank you very much. Kelly, let's go to questions.
All right. Director Stringer, you available? Any questions for Director? Mike Phillips?
Hi, Director. Over here. Is there any special focus right now on the needs of young people? I'm thinking with schools having been out, obviously counselors have also been out or working remotely, so are there any challenges there that you're working on?
Certainly challenges, and we are working with young people. We've got a variety of not only treatment services available, but also prevention services. And prevention services that are designed for schools that we are adapting to the current situation. So absolutely keen interest in serving kids, and we'll continue to do that. Okay, thank you.
General, do you see the food distribution being expanded at all, maybe to more schools over the summer?
Yeah, it's a good question. Currently, we think we're about where we're going to be. I would suspect the demand, we're very hopeful, frankly, that the demand will reduce as our times get better in the coming weeks. But we'll always be ready with the need.
And to expand testing, how many more soldiers and airmen do you think would be needed to do that?
Yeah, well, we're fortunate. I think I briefed earlier, we have 1,000 on orders right now, and we're able to adjust our work effort across our lines of effort. So I don't know that we'll actually need to bring on that many more, if any, to complete the testing. But should we need more, they're available. Thank you.
Good afternoon, General. I know you said we'll know more tomorrow about how that testing mechanisms will work, but just in general terms, how can the Guard assist with testing? Is it delivering tests? Is it helping to set up a testing site?
Yeah, it's a great question, and you're correct in your two parts there. We can provide a myriad of things to support. You mentioned setting up test sites. We can actually support with the testing with some, in conjunction with medical support with the local agency. So transportation, logistics, setting up the site, data entry, and there'll be other things that come out through the rest of the staffing today, but we're excited to be a part of this. Thank you.
All right, thank you, General.
Thank you.
Director Williams?
Let me give you a quick update on some things that I discussed with you earlier. We finished the testing at Affinia up in North St. Louis, and those zip codes were specifically picked because of the morbidity and mortality, sadly, we'd seen come out of there. And of 359 tests, 20 came back positive, and I know Mayor Cruson and Fred Eccles will be very interested in those results as we transition. About 15 are still pending, and some were inconclusive. And another number that we're very excited about is about half an hour ago, we got 2,040 more vials of remdesivir, and we will ship that out in the next 18 hours as soon as we get the word from the hospitals that need it and patients. And you heard the governor discuss the patient who was pregnant, who that very much changed her course, her clinicians felt. And so we're incredibly excited. That's our third course, and we got that a day ahead of time. So we will get that out today, and I think people have nationally recognized how quickly we've done that. And then the last number I'll give you is 9,254. That's the number of residents that live in the 50 nursing homes that have had one patient or one staff member in the last 14 days test positive. And we are actively going in and doing our boxed-in strategy for those 9,254 people as we speak. You know, the governor said we couldn't do that, to use a military term, a force multiplier. Not only do we work well together in the cabinets, but we make each other better. And I know the other cabinet directors make me better. And so we're incredibly thankful for that. So I just wanted to give you that follow-up to things that we've been talking about.
Any questions for Dr. Williams?
Great, thank you.
Governor Parson?
Thank you. Just one follow-up. What somebody asked the general, I mean, how many troops he was going to have or how many he was going to deploy. I'm going to help him with that a little bit too, whatever we need. That's what we're going to deploy to meet those goals of that. So all the agencies know that pretty well, that the task is to go out, get the mission. We know what the mission is, and now it's time to execute the mission. So on that. So I'll be glad to take a few questions, or if I'll be glad to finish this up too. Won't matter either way to me on that.
Good afternoon, Governor. I don't know if you had a chance to see about the Missouri Chamber calling for a special session to address some concerns they have about the possibility of some of their members being sued as a result of COVID-19 related cases, what your thoughts were about that.
Yeah, well, you know, there's as we see other states and other things popping up on the legal challenge, it's quite apparent we're going to have to deal with the legal challenge that's going along with COVID-19. Look, whatever we need to do is calling the legislators back, but it won't be for one individual thing. If I call them back, we'll have some things in place that we need to do. There's still some issues that are very important to the state that need to be addressed, but we're going to be we're not going to let attorneys go out here and sue everybody because they was doing their jobs of COVID-19. So whatever it takes to kind of even that playing field, we'll plan on doing it in Missouri.
You mentioned yesterday you were meeting today with colleges, universities. How did that conversation go? Were they receptive to what you had to say?
Yeah, I met, we actually were online with most of the university and community college presidents this morning. We talked to, I think, a little over 500 superintendents across the state to pretty well tell them what to expect, what things look like in numbers right now. What we really told them that between now and July the 1st, there'll be more withholds coming up in the next probably week to 10 days to finish out 2020. But we're still looking at a hole of about $500 million to $700 million starting out July 1. So depending on whatever comes down, if there's more portions of the CARE Act that comes down or whatever comes down. But right now, we got to be prepared moving forward that we can meet that demand. And I wanted to make sure the superintendents across the state and the college and the universities know that we're going to have to kind of buckle down here a little bit for a while to get by, and if there's no other help coming. All right, thanks everybody for being here today. Thank you.